When we were young, we are always very impressionable. I once toyed with the idea of taking up a flying career in my youthful days, but fortunately I was talked out of it by my parents. Medicine and cardiology to me is a much more gratifying and rewarding experience. I think the most gratifying achievement that I have done in mentoring is that our team at National Heart Centre have not been selfish or self-centered. They have freely shared their skills and techniques with successive generations of younger colleagues and have not been afraid that they will be surpassed by their students. There are many challenges in today's cardiovascular treatment and care, but we cardiologists are really very fortunate to be in the right era. As a young student, the only treatment that was commonly available for IHD patients was GTN. Bypass was not available in Singapore at that time. Now we have introduced devices like TAVI and mitral clip for the treatment of valvular heart disease, left ventricular assist devices, amongst many other devices. We have also grown our basic research capabilities to better position ourselves as an academic institution of repute. We started Sing Life in 1989, an educational meeting to impart knowledge and technical skills to the wider audience in the Asian Pacific region. We felt that to impart this knowledge to the less developed regions in Asia was important for us. So yes, it has been a very testing and challenging task to sustain the momentum. It has taught me a good lesson in life, and that is perseverance is key to success. Hopefully, the Sing Life course will grow even bigger in the coming years. I think patients deserve your best care. That is a very satisfying experience for me. It has kept me all through these years, and I enjoy coming to work every day based on this mantra.
I live by the golden rule, which is I want to do to others what I want them to do to me. This is part of my religious belief. I always teach my young doctors to treat their patients as though they are their relatives. I was trained in an earlier era when research was not emphasized and everything was directed towards achieving the best patient treatment outcome by clinical examination and by using limited resources. My publications were mainly case reports of my patients with uncommon and unusual conditions and the outcome of my treatment. So in a sense, they were all very personal to me. Up to the 1990s, we were all practicing as generalists, treating all sorts of conditions. We realized that in doing so, we would all end up being a jack of all trades and master of none. Our young neurosurgeons need to subspecialize. They're not lacking in knowledge or resources, they simply need guidance under more experienced mentors and may be as good or even better than their teachers in time to come. That's something I expect from them. Whenever I cook, I forget everything else and simply concentrate on the ingredients and how to turn them into food that everyone enjoys. In the process, we need passion and attention to small details to make even simple ingredients become an excellent dish. My outlook in career is no different. As neurosurgeons, we need to pay attention to even small details because the brain is a very delicate structure and we need to ensure that we do things right the first time, all the time. If I were to summarize my career journey in just one word, that word would be satisfying. All the past challenges and long hours in the wards and operation theatres are forgotten. Whenever someone I cannot recognize come up to me to thank me for having treated and saved them or a loved one in the past.